Welcome to Open Your Mind Before You Open Your Mouth, a companion resource to accompany the Family Connections program. The materials for this DVD were developed by family graduates of this program, their loved ones, and experts. In this section of the DVD, you will learn a little bit more about family connections, and you will also come to realize that you're not alone in struggling to understand the difficulties associated with intense emotions and their related behaviours.
Family Connections is a program that we've developed for family members of people who have loved ones with chronic problems with emotion dysregulation, sometimes what we call borderline personality disorder. It's a program that has three core goals. The first one is to provide state-of-the-art, up-to-date psychoeducation or information about the disorder, treatments that are available, what we understand about families, and so forth. The second goal has to do with helping family members learn skills to manage these very difficult, sometimes very painful situations with their loved ones. And then the third goal, of course, is to get people together who have these things in common and allow them opportunities to provide support to each other. It's fairly common for people who have loved ones with borderline personality disorder to feel isolated and alone, and by coming together into a program like this, that can be extremely helpful by itself.
Borderline personality disorder is one of the most distressing disorders for the individual and their families, and it's really one of the most difficult for clinicians to treat. A Vision for Change, the report of the Irish Expert Group on Mental Health Policy in 2006, stated that very often people with borderline personality disorder will present with long histories of repeated self-harm behaviour and very severe emotion dysregulation.
Borderline personality disorder is a term often used by mental health professionals to describe a number of symptoms that you may be experiencing. We tend to try to diagnose this disorder to help us to select the most appropriate treatments and interventions that we have available to us based on evidence and expert opinion. Typically, borderline personality disorder is diagnosed using several criteria. There are multiple different classification systems which are being used internationally. In the US, the Diagnostic and Statistical Manual for Mental Disorders is commonly used to make the diagnosis. In Europe, the International Classification for Disease, version 10, is more commonly used. There are 5 key areas where people with borderline personality disorder can become dysregulated. The first area of dysregulation is emotional dysregulation. Typically, people with borderline personality disorder struggle to both understand and name their emotions. They often experience intense periods of anxiety, worry, and depression. The second area of dysregulation is cognitive dysregulation. Sometimes people with borderline personality disorder will experience brief transient psychotic episodes. These include paranoid thoughts or sometimes even voice hearing. This is quite common when people are experiencing intense emotional distress. Often people will also report symptoms of dissociation, or what we typically would explain to people as zoning out when under extreme emotional distress or pressure. So the third area of dysregulation that people with borderline personality disorder experience is behavior dysregulation. It's not uncommon for people with borderline personality disorder to engage in behaviors such as cutting or repeated suicide attempts using overdose. Often these behaviors are also associated with alcohol misuse or substance misuse. And often people will engage in promiscuous sexual behaviours. The fourth area of dysregulation is dysregulation of self. Sometimes people with borderline personality disorder struggle to create an identity for themselves. They find it increasingly difficult to engage with those around them and often will be almost chameleon-like in trying to fit with their environment. The fifth area of dysregulation is interpersonal dysregulation. People with borderline personality disorder struggle to engage in meaningful relationships. They often seesaw between, on the one hand, valuing the person and putting them on a pedestal, to when in crisis, quickly devaluing the person and not wanting to be near them at all. This can be very difficult for people to comprehend and understand.
Family members or loved ones very frequently report that they were initially unsure if they were even attending the correct programme, or if in fact they needed to attend a group programme in the first place. In the next section, you will meet John and his daughter Mary. Mary is 24 years old and was diagnosed with borderline personality disorder 3 years ago. However, Mary has experienced the symptoms of BPD for many years now. Since she was 15 years old, she has been engaging in self-cutting as a means of regulating very intense negative emotions. However, over the past 2 years, Mary has been presenting at the local emergency department with increasing frequency. And also during this 2-year period, she has been an inpatient in an acute mental health unit for a significant number of months. Mary is now 5 months into a year-long dialectical behaviour therapy programme.
Hi, I'm Mary. I'm guessing you're here because of someone like me. As a parent, sibling or a loved one, you're probably wondering, does anyone else have to deal with self-harm and intense emotions? Because that's what it's like for me and my family. And I'm guessing that's what it's like for you and yours. Anytime I asked for help, they just filled me with pills and empty promises that things would get better. They didn't. At times I feel so lost and empty, pulled away from everyone I know. I find it all so overwhelming. Sometimes the only way I can deal with it is to dig in, even if it hurts.
John is Mary's dad. In the past, John has really struggled to understand Mary's self-harm behaviour. However, he recently completed the 12-week Family Connections programme.
The first time I realised that there was something really wrong was when Mary was 16. She went drinking and stayed out beyond her curfew. Her mother and I gave out to her, as any parents would. And the next morning, she'd left a note for us on the kitchen table. That was the first time we found out that she cuts herself. We tried to get her to talk to the GP, but she just shut down. We thought it was just a rebellious phase. We hoped it was, but we were wrong. She overdosed when she was 17. And that was the first time that she was admitted to an adult mental health facility. Since then, it's been a constant worry about the what-ifs. Each different doctor comes up with a different diagnosis. It's depression or anxiety or just a phase, And I mean, if they can't figure it out, how can I? If, like me, you're wondering, am I in the right place, or am I the only one, or surely other people aren't having the same experience? Well, this is where I got help. Family Connections has changed my perspective. I know more about Mary's diagnosis. I've heard from people who tell me that I am not alone and that all of my feelings are perfectly normal in very difficult, high-stress situations that won't go away.
When we have a loved one who's in a lot of pain, we're used to looking for professionals to have answers and to be able to help our loved ones get out of pain. And that pain more often is physical and medical. But when it's emotional and psychological, we also want professionals to take care of it. And of course, that's a completely reasonable thing to want. The trouble is that we don't know that much. We aren't as able to help as we wish we could. And so for some people, for many people, unfortunately, the options that are available are very inadequate. Either they don't work very well, or even if they work well, they don't work very fast. And so having a loved one be in tremendous pain and not having resources that we want is a situation where it's very easy to become judgmental. That we should have better treatment. We should have better professionals, more people who can make a difference. And in reality, these are really difficult problems. They're not easy to solve. And even when we're good at solving them, they still take longer than we wish they did. And so getting judgmental of professionals is a pretty ordinary thing to do, but it creates more suffering. It creates more suffering for the family member and ultimately can, if it gets big enough, create more suffering for our loved ones too.
So many times I've been called to A&E, panicking, feeling helpless, wondering what we did wrong. It felt like this was a permanent mess. It's happening, but I don't want it to be. Mary is impulsive and very sensitive. She gets really emotional and overreacts to situations. So at home, it's like walking on eggshells all the time. My wife says that she can't cope anymore, that she's burnt out. We don't want to burden our other children, Jason and Luke, with Mary's problems. But I mean, they know she's been in hospital a few times. So it must be hard on them.
Family members who have loved ones with chronic emotion dysregulation often feel like they're the caboose and their loved one is the engine on the train, that they have to go where their loved one goes. And that's often way up and way down and all around. They also often feel a bit alone. There's still lots of taboos in our society about this. It's not so common to come to work and say, gee, I'm so worried about my daughter or my son who's self-harming on the inside of his or her thigh, and I'm just so worried. I don't know what to do about it. I don't know what this means. It's not the sort of thing many people feel comfortable bringing to their friends or other people, or even to professionals. Family members also frequently get exhausted and sometimes blame themselves. They sometimes go through periods they say, gee, there's something I could have or should have done differently, or this is my fault. There's no evidence for that, by the way. It's not that clear, but that's a common thing for family members to feel. They can also feel really burdened, very sad, and like they just don't have much control over their own lives. So as we think about trying to help our loved ones out of hell, we say, well, what's our job? What's our role? And the answer to that is, it depends. It depends on what our skills are. The more skills we have, the better able we are to help our loved ones either accept or change, or both. The better able we are to help ourselves accept or change, or both. So we have a responsibility that is in keeping with our skills. So if we don't have many skills, there's not much we can do. And then all we do is feel frustrated. Now, being responsible for change is not the same as being responsible for the problem. If I'm walking down the street and a person in front of me falls down, maybe looks like he or she's having a heart attack, it's very clearly not my fault. It's a stranger, nobody I've ever met. I wasn't doing anything except happening to be walking on the same sidewalk a little bit behind that person. But clearly, as a fellow human being, I've got the skill to take out my mobile phone and phone an ambulance, or to yell, or to go and comfort the person. I've got the skill to do something. And so because I have the skill, we'd say, I have the responsibility to do that. But it also is a balancing act. We have to not only take care of people with the skills that we have, we also have to take care of ourselves.
It can be extremely difficult for your loved ones to regulate their behaviors when their emotions run increasingly high. This can be difficult for family members to fully understand, and is equally difficult for professionals. Sometimes, in the midst of such emotional chaos and crisis, we find it very difficult to respond effectively. In the Family Connections program, you will learn more about borderline personality disorder. You will also learn how to use skills to respond more effectively in these crisis situations. And most importantly, you will realize that you're not alone in your struggle to understand and cope with these difficulties.
I've gotten information, support, and most importantly, skills, so that I can think about Mary and her difficulties in a different way. I remind myself that Mary is someone that I love, and that at times, although I don't understand her, that reacting with judgments and harsh words only damages our relationship. It pushes a wedge between us and increases the likelihood of Mary becoming more emotionally charged. I see this happen with her mother, Anne-Marie, who really struggles with Mary's behaviour. I mean, Mary and Anne-Marie have both said some very cruel things to each other over the years, and when there's conflict, it all gets drawn up. I've tried to encourage Anne-Marie to let go of this and share my learning from the group, but she's not there yet. I've learned that the things she does impact on us, but she isn't doing these things to us. I'm more mindful now of my reactions. I try to mind myself a little better and reduce my own emotional vulnerabilities. They talk in the programme about your rights and healthy selfishness, which were alien concepts to me. I mean, I thought that I wouldn't be able to cope with how I felt, the what ifs and the loss of my perfect little girl. But now I accept that this is the way that it is, and me wanting it to be different only adds to both mine and Mary's suffering.
In responding to somebody with extreme difficulties in regulating their emotion, we can sometimes struggle with the notion that they are doing the very best they can. This acknowledgement that they are doing the best that they can doesn't mean that we accept that the behavior is good enough. Often we will be looking for your loved one to try harder and do better. Similarly, we're also asking you as a concerned person to try harder and do better and become more mindful of your response to these crisis situations. When we become mindful, we make a choice to effectively respond, and if we can't do anything to make the situation better, at least we need to fully commit to not making the situation worse.
At times I feel really guilty about what I put my family through. If I could take it all back, I would. I'd be a different person. I really want things to change because I can't bear the thought of going on like this forever. But with the skills I'm learning with DBT, I think there is some hope.
I don't or won't ever like Mary's self-harm behaviour, but I accept that it's happening, and I want to support her in learning new skills. If I can't make it better, then I am committed to at least making it not any worse. I now have a healthier relationship and communicate better with Mary. We've both learned new skills, and we recognise the effort that we're making to try to improve each moment. It's a work in progress, but we are moving forward, and there is hope of a life worth living for Mary and for the rest of us as a family.